Welcome back. In the United States, approximately 21,000 stillbirths occur each year, amounting to around 65 deaths per day. This is equivalent to losing 3 entire kindergarten classes every single day. Push for Empowered Pregnancy, in collaboration with Earth Mama Organics, has launched a powerful awareness campaign titled #United We Push to shed light on this critical issue. Joining us now is the Executive Director of Push for Empowered Pregnancy, Samantha Durante Banerjee. Samantha, thank you so much for joining me.
Thank you so much for having me, Kibin.
Now, can you share the inspiration behind the creation of Push for Empowered Pregnancy?
Yeah, so sadly, we came to push for the worst possible reason. In 2013, I was pregnant with my first child, my daughter Alana, and I showed up at the hospital in labor 2 days before her due date after a totally normal, healthy pregnancy that I was told was textbook the entire time, only to find out she no longer had a heartbeat. And so I had to deliver her after she had died, and that is what a stillbirth is, a word I had not heard through 9 months of pregnancy, and was shocked to learn that this was actually happening, as you said, to 65 families every single day in this country, and that the rates had barely budged in decades. And so in 2021, after several years of just watching this continue to happen to other families, and particularly happening to Black and Indigenous families at twice the rate as happens to white families. It's just a bunch of us bereaved parents from across the United States got together and said, enough is enough. We've got to do something about this. Nobody else is making it a priority. By that point, we'd seen other countries start to implement some stillbirth prevention methods that were having huge positive effects. And so we said, if they can do it, why can't we? We just need to make sure that our government and public health and medical system knows that this is possible and that we are demanding change.
And I want to thank you so much for sharing your story. As mentioned, unfortunately, this is happening to so many people across the U.S. in staggering numbers. What are the key factors to contributing that contributes to this issue, particularly concerning preventable cases?
So I would say the number one thing, honestly, driving the stillbirth rate in the United States is the lack of awareness. Families like me are just being completely blindsided by this every single day. This is not something that providers are actively educating their patients about. If you don't know someone who's had a stillbirth, you probably don't even realize this is going on. There's a lot of misconceptions that this only happens to, very, very sick babies, or families, where the pregnant person has underlying medical issues or doesn't have access to care or is doing something, wrong, like drugs. And that is just simply not true. Stillbirth, 80% of stillbirths take place in pregnancies where there were no known maternal risk factors at the start of the pregnancy. And most of these babies are otherwise healthy. They're typically being caused by issues in the placenta, cord accidents, infections, issues like preeclampsia. And many of these are detectable if we only put in the time and effort to, number one, teach parents what to look for, and number two, make it a priority to catch these cases before uh, children like my daughter who fall through the cracks in otherwise, low risk pregnancy.
Now, could you explain the significance of the #United We Push awareness campaign and its goals in tackling preventable stillbirths?
Yes. So, I mean, since awareness is kind of the number one hurdle at this point in time in the U.S., the best way to get the word out is by working together. Word of mouth. We need everyone to help pitch in. And when we founded Push, working collaboratively with other organizations in the maternal health space, including not just stillbirth, but also maternal mortality and infant mortality, because these issues are very, very intimately linked. Has been part of our mission and a huge part of our success. And so we always say we're stronger together. And so we're trying to call everyone in. If you know anyone who is pregnant, it is absolutely critical that they get this information in front of them. So anything that you can do, and it could be as simple as just going to our website or any of our social media accounts or Earth Mamas at Push Pregnancy or pushpregnancy.org. And you can find that PSA ad there. It's, under 90 seconds, and you just click share. However, you think your friends and family are most likely to see it. And even just knowing that it's a possibility that this could happen to you in an otherwise, healthy, normal pregnancy, helps to prevent stillbirths. Because if you don't know um, that your baby can die that late in a healthy pregnancy, you don't think to speak up about it if you notice anything different or anything concerning. And what we're always telling parents is that you know your baby in your body better than anyone. If anything is different, anything is concerning, you should speak up right away, because in many cases there is time to act. And if you put the call into your provider and push to be heard, which again is an issue for a lot of families. But if you know that this can happen, you're much more likely to speak up and to keep speaking up until someone hears you. And so that's the inspiration behind United We Push. Parents need reinforcement, and they need validation when they have concerns about their pregnancy. And so we want everyone to know that this is a possibility, and that if someone who is pregnant is having concerns, you should tell them, go to your provider and get checked out. There's no reason not to get checked out. That's why they're there.
Now, what is the Shine for Autumn Act, and what role does Push for Empowered Pregnancy play in advocating for this act?
So the Shine for Autumn Act is one of two federal bills that are in Congress right now, which is historic because I think it's the first time ever that we have had two bills advocating for stillbirth prevention in different ways in Congress at the same time. So we are one of many organizations who are helping to promote these two bills. The Shine for Autumn Act is particularly focused around data collection. We have many issues with the data collection around stillbirth in this country, where they are not being reported the same way that live births are. Many times they're unreported or reported with incorrect data, and so there's things in there to try to fix that. There's also aspects of education for families and providers, and training additional perinatal pathologists, so that when there is a stillbirth, we are understanding exactly what caused it, and recording that information in a way that researchers can actually access, because that has been a huge barrier to progress in the US. The other bill is the Maternal and Child Health Stillbirth Prevention Act. And that one is specifically focused around making sure that states know that they can use their Title V funds for maternal and child health towards stillbirth prevention efforts. Because right now, the 30-page Title V Maternal and Child Health Act does not mention the word stillbirth once. And so this is to kind of remove that barrier and make sure that state Department of Health know that this is something that they can and should be prioritizing, and that they can use those funds that they get from the government for it.
How does your organization collaborate with health providers and other stakeholders to empower expecting families with essential education and equitable medical care?
So, I'm glad you mentioned equity, because that is like the number one thing that we are really devoted to a push, and I think really sets us apart from others in our field. As we know, Black moms are more than twice as likely to have a stillbirth, and this is for many of the same reasons that we see when it comes to maternal mortality and morbidity. Basically, many of these issues are related to social determinants of health, and to systemic racism. And so we think it's really, really important to call that out. Number one, because again, awareness is the first step to prevention. You cannot solve a problem that you're not willing to name. And so we are doing a lot of top-down advocacy. Obviously we work directly with families to empower them with all the information that we wish someone had given us. And so we share a lot of empowered pregnancy tips and stillbirth prevention tips through our social media or at our website. And but that is just a stopgap solution. It's a band-aid on a bullet wound. What we really need is top-down systemic change that is going to close the gap, number one, between Black and white birth outcomes. If we did that, that alone would save 4,000 lives every year. And so, and in general, and for all families, we need to combat the paternalism that we often see in medicine, and particularly in obstetrics. We need to make sure that providers know that stillbirth is preventable, and that there are tools out there right now that research is showing can prevent at least 1 in 4 stillbirths in the United States, including half of term stillbirths that take place at 37 weeks or later, like my daughter's. And that's a conservative number because if we look at what's going on in other countries, if we match the rates of our best international peers, we could be preventing up to 75% of US stillbirths. So there's a lot of progress to be made. And while that is very frustrating to those of us who have lost a child to this potentially preventable tragedy, it is also encouraging because it means there's a lot of low-hanging fruit. So we've been working with the NIH, the CDC, the HRSA, the Health and Services Administration, who does Title V, just trying to make sure that they are aware of what's going on in other countries, of the tools that are available, that us and many of our partner organizations are providing at very low or no cost. And most importantly, making sure that they know that parents are fed up, that it's not fair to expect us to protect our children against a risk that no one even bothers to tell us exists. Stillbirth right now is claiming more children's lives in the US up to age 14 than prematurity, SIDS, car accidents, drowning, guns, fire, poison, flu, and listeria combined. And just like any of those things that we are, warning parents about on the regular, there is things you can do to lower your risk. It's not always preventable because accidents happen, but there are steps you can take. And for some reason, stillbirth is one exception where no one tells you about it until it's already too late. And then parents are left, with these excruciating what ifs for the rest of their life. And we don't want that to happen to any other family. And so that's really the big message that we're going to, the powers that be in our country's medical care, to say we need better standards, and you owe this to families, to make sure that they and their providers are given every possible chance to make sure the baby gets here safely.
Now, I definitely want to highlight this because it's so important, and it's in regard to mental health. Is there, a stigma surrounding stillbirth, and what goes on for the people who had to experience that? Is there something that are there any resources available, either from the hospital or from anybody when somebody goes through something like this?
Yeah, so unfortunately, there is a huge stigma around stillbirth because, of course, this is a horrific experience and something no one wants to ever think could possibly happen to them. And so, as a result, many parents end up blaming themselves, especially because so few of us get answers. As the Shine for Autumn Act would be addressing, there are literally not enough trained perinatal pathologists in this country to examine properly every baby that's born still. So as a result, about 50% of families never get an answer. And so what that leaves you with is moms like me thinking, well, if I was healthy and my baby was healthy, and my doctors tell me they did everything they were supposed to, then that means I must have done something wrong. Like what else could it possibly be? And so the stigma is really, really difficult because there is so much guilt and shame involved, and also there's a really deep lack of understanding that stillbirth is still a birth, number one, and that these are our children, and that maybe we didn't get to know them the way that we would have liked to, but we still love them just as much as we love any of our other children. And I can't tell you how many families hear things like, "Oh, you just try again, you'll have another baby," as if another child could, replace the one that you lost. And so, there's a lot of trauma. And thankfully, in the last, 10 years since my loss, a really beautiful community has grown up on social media, especially on Instagram and TikTok, where families are more openly sharing about their experiences, and able to find support a lot easier than they could in the past. And there's also nowadays a ton of fabulous resources. So we actually, on our website, pushpregnancy.org, have compiled a long list of resources that were handpicked by other stillbirth parents, things from books and websites and social media accounts and podcasts and films, and tailored, some specifically for non-birthing partners and dads, some specifically tailored to LGBTQ families, some for families who go through terminations for medical reason, etc. because there is a lot of support out there, and no one who goes through this has to be alone. And we think it's really critical that families also know that they're not powerless to create change in their baby's name, and that's what we do at Push every day.
Now, what are some ways Push advocates for reproductive justice and equitable access to reproductive health care overall?
Yeah, so again, we work really closely with our partners in the Black maternal health community, particularly the Speak Move Change Collective, which does a Black Maternal Health Week event, and also launched the first ever National Postpartum Awareness Week, which is going on this week actually right now. So head to speakmovechange.org in order to speakmovechange.net in order to register for that because it's free. And it's to shed light on a lot of the the disparities and the particular challenges that families of color face to get equitable health care. We also, we work closely with March for Moms, with Melanated Moms, and many others to basically try to share knowledge between our communities. Obviously, the maternal mortality community has done an absolutely fabulous job in the last few years of making maternal mortality prevention a priority in this country, and specifically by addressing some of the systemic and structural racism that takes place in our healthcare. And so we're trying to work with them to learn from them and apply those same lessons to stillbirth prevention, because again, there's a lot of the same prevention techniques, and so we have a lot of synergy between our two communities. And the other thing we really focus on is just making sure that the voices of parents of color are heard. Unfortunately, so much of the way that our medical and public health system is set up, it's just not accessible for people to even get their voices heard. Like if you have a 9 to 5 job, um, you can't attend any of these NIH hearings, which take place, for 5 hours in the middle of the day. And so, you end up having a lot of voices like mine, white suburban moms who are privileged enough to have childcare, who are speaking out. And so, one of the things we do at Push is really try to um, create opportunities where other voices can be heard, the people who are bearing the brunt of this burden. Um, and making sure that their experiences are recorded by the people in power so that we can create large scale systemic change that's going to benefit the most heavily burdened populations first.
Well, Samantha, I want to thank you so much for joining us, sharing your story, and talking about the work that your organization is doing to help so many people who are dealing with similar challenges. So, thank you so much.
Well, thank you so much, and we really appreciate your help getting the word out. Again, awareness is the first step to prevention. So, anyone who can help us share that PSA from our website or social media with Earth Mama Organics, we'll be so grateful. We just want to get the word out to as many families as possible.
Thank you. We'll
Thank
be
you.
right back after this.